In this section, we will add the collaborator information and start a new patient. So let's go on to the lower part of the sheet. So this shows you which sheet I am sitting on. You always start your project by entering your collaborator information. Go to the top of the sheet and enter your collaborator information. Doe, John, just do uppercase if you can, and title, professor, honestly it doesn't matter. Department is pathology, perhaps you have someone in medicine, and section, maybe you may be in a hematopathology section, and that institution is a drop down. You can pick your institution right there. Let's just go Detroit, and city you can say Detroit, and country US. Yeah, I will probably add a code for the state, and then check your email, ORCID, and Twitter handle. And after that, we will go on to the pathology sheet, which is where you will add your first patient that is a good fit for the study. Do not try to enter patients who you're screening. I want only final lists over here. You can have your separate things offline from this Excel file. So let's go to the top of the pathology sheet where you will find this area. Right in row 7 is where you start your first patient. All the other rows will be locked. The column, this top header row will also be locked, so be mindful. Let's add 1, 2, 3, 4, 5, 6 is a good number. Let's pick your institution yet again. You will have a lot of drop downs and date validations. Let's say this patient was born in 1/1/1966, and then you can drop down and raise. The moment you tab, you go to the next field. That's a much better way to move between fields. Then you enter your number. Let's just say your number was UTO21 dash something, yeah. And then this column will be locked. Serial number is already there for you, so you cannot click and change it. Let's get some sex going, female, and then let's enter diagnosis date. There are validations in all these dates, so the diagnosis date has to be greater than the date of birth. So if I enter maybe 1/1/1965, you're going to get an error, and it'll tell you what the ranges really need to be. It needs to be more than the date of birth, and it needs to be at least 10 years after the date of birth, so the patient can only be around at least 10 or older when they are diagnosed, and it should be less than today's date. Yeah, you cannot have a patient diagnosed today getting into this database. So there are date check rules here. So make sure the rules are correct and you follow the rules. And if there are obvious violations that you actually need to enter, then just tell me ahead of time in an email, and maybe I can do some fixes on the back end. So that was your first patient right there. And so let me enter a good useful date, 1/1/2011, right? And then that will work, right? And then that's it. So let's stop at that and go to the other sheets where all of this information will be carried over. So let's go to the lower. Maybe you go to the NGS sheet, and you look at the top of the NGS sheet. That information is already carried over, including the date of diagnosis. And then you go all the way to the clinical sheet, and yet again, that information is carried over in row 7. You can see that. And same goes with if the patient has gotten a transplant, you will again see it in the transplant sheet. Yeah? This is basically the transplant sheet that I'm on, and this is the top of the transplant sheet. In row 7, you see the same patient, and you can enter the data. So there will be less room for errors when you do it this way. So let me stop with that, and in the next video, maybe I'll show you some information from each of the sheets and some judgment issues for each of these sheets. Thank you. Hey everyone, I'm just continuing from the previous video where I don't think the error box was easy to see. So this is again back to the pathology sheet. I'm going to the top of the sheet where I'm showing you the diagnosis date. So let's say I enter something less than 2010. Let's see, 1/1/2008, right? Then you get a date check rule. where this says the diagnosis date has to be after 2010, and it has to be 10 years more than the date of birth, and it has to be less than today's date. So it'll give you the set of validation rules that's on the back end. So make sure you type the correct dates, and this will be the most logical dates. So I will now enter 1/1/2021. It's now this follows all the rules, so that works. Yeah. So that's your date validation rule that will work. And most dates have validation rules. They may not all have the perfect date check statements, but be mindful of the dates logically. In this, we will enter a new patient starting with the pathology sheet, and I will show you the process for a complete row of patient. So here we start with the medical record number, which you will delete later. Like I said, you will clear, not delete. So there's a random number there. And let's get the institution going. Let's say this was maybe Utah. And then you enter the date of birth, 1/1/1971, right there. And then the race, you can pick your race if you have it. And then your number there, maybe UT24 there. And this column is going to be locked. This is a serial number that you don't need to fiddle with. The next is sex. Let's pick one sex. And date of diagnosis, again, you will have a box that tells you the first instance of P53 mutation and the myeloid neoplasm. So let's say 1/1/2009. Again, you got an error because you need to have a date only after 2010, excuse me. And patient needs to be at least 10 years old when they get diagnosed. So you will see what's wrong. So then I will say re-enter and then go on to 1/1/2021, right? That'll work. Let's say there's a therapy-related myeloid neoplasm. That's fine. Hemoglobin units are easy, 13.2, a random number. And WBC, ANC, and platelets are all going to be in the 1000th place. So don't enter the thousands there. Just enter the number you want to say before the 1000th place. So here, let's say WBC was, let's say it was 11, right? That's and then the absolute neutrophil count is, let's say it was 1000 per microliter, like the monocytosis, and it tells you the unit in the box right there. So I'm going to say patient had really bad neutropenia with ANC below 500. So for 500, I'm going to say 0.5, right? I'm not going to say 500 there. And a platelet count, let's say give them a normal platelet count, let's say 350. And circulating blast, maybe 2%. And the patient have any prior myeloid neoplasms, maybe a CHIP, maybe a CCUS. Maybe this is after HMA therapy for MDS. So let's say no prior myeloid neoplasm in this case. And if there was a prior, then you have a date over there for that. And then the patient, the therapy-related myeloid neoplasm, yes, it is a therapy-related. And if that's the case, that they get chemo, radiation, maybe both. So maybe patient got both. This was a breast cancer patient. Let's just make this a female perhaps, right? And let's say there was prior chemo radiation, maybe it was breast cancer, and then prior solid tumor, right? That's what you check for that. And let's give it a date of, I don't know, 2016, 1/1/2016. Maybe they got 2018 is fine too. And the marrow CD34 blast count, if they did a CD34, else leave it blank, let's say 23. And if they did an aspirate blast count and they actually only got, I don't know, 12 perhaps, then there's a discrepancy there, but get that number going. I will end up using the highest of the two numbers likely. And if they did a P50 IHC, in this case they did do it, and if they put a number on the number of strong positives, right? You don't want the rare weak positives, which is the wild type. Strong positives is what we are counting. Let's say there was 45. Sometimes you see a lot more P53 than 34s. So, and the next is the erythroid percentage in the biopsy. If it's from the differential count, we will try to correlate erythroleukemias versus non-erythroleukemias later down the line. And erythroleukemias tend to do worse, right? Even if they're glycophorin A, that's fine too. And then monosomy 5, monosomy deletion 5q, monosomy 7, and then you have your, sorry, I need to scroll just a bit. So here you have either the deletion 5q, monosomy 7, deletion 7q, monosomy 17, and 17p fish, right? Let's say all of these were abnormal, right? Present abnormal. Then I just say present abnormal. And then just maybe you don't have 7q data, that's fine, let's choose that. Maybe you don't have this data. You don't have this data, right? And then you move on to the karyotype. So here is where things get tricky for fields where I'm letting you totally copy paste from the karyotype from your report into this section. So when I pick a chunk of text, like I'm going to pick a small chunk of text here, let's just pick this random code bit, and I want to paste this in that cell for karyotype. So I don't want you to right click and paste special and do any of that. If you do stuff like that, then you see how all the text goes into the adjoining cells and the whole file will get corrupted. You don't want that. You don't want this either, where it keeps all the formatting and throws stuff into the next cell down below. So the correct way to paste is go up all the way to the formula bar, which is called formula bar, that box up there, and you control V as in Victor, right? And hit enter. And then the whole thing gets pasted there, and the whole thing gets contained in that cell in a text format, and I can mine that text string and get my information. This is exactly how you paste for fields that involve pasting. So if you end up corrupting the file for some reason, then just let me know and I'll try to get into our share drive and fix the field. But please use this way for pasting. There's like 3 or 4 fields here and there where I'm letting you paste stuff. Most of the others have validations or are drop-downs. Next, last 2 fields are germline mutation, yes or no, and of course, if you had a mutation, then what gene, and any comments you want to leave for me, you leave in that last field out there, and then that's it, and save the file, and then obviously you can go on to the probably the next sheet. Maybe we will end up doing the NGS after this, which we will discuss in the next tutorial. Yeah, thank you. So we just finished the pathology sheet, and let's now go on and enter the NGS information for this patient. Let's shift to the NGS sheet. Let me click NGS. Let's go to the top of the NGS sheet, and we enter the date of the NGS, and there's already a box that tells you your date range compared to the diagnosis date. You can have it plus or minus 3 months. So let's just pick a date, like 1 month. You know what, maybe I'll pick the same date, 9/5/2018, and then let's pick a sample, blood, marrow, other, and this was a bone marrow, so let's pick bone marrow. And there are allowances for up to 3 TP53 mutations that you can list. Anything more I'm kind of ignoring, but most patients have like the maximum of 3 mutations in any given sample. So here is the first mutation, which corresponds to the one with the highest VAF. That's what I want here. And there is a validation going in there. So let me show you how things will work. So the mutation should have a C change and a P change, right? A nucleotide and a protein change. Only if both elements are there, the cell will remain gray or white for that matter. If you're missing either the nucleotide or the protein change, you're going to have issues, right? Let's pick a perfectly good one. So where you have the TP53, a nucleotide, and a protein change, which is listed here. And this is actually a missense, so that's good. And let's give it a VAF of, I don't know, 75. And I go to the next one, and I choose to just do the nucleotide without the protein, right? That's also sometimes okay. And if you do that, then the cell will just change to an orange color like that, right? Which means things are not quite okay, but I can still work for the nucleotide change and try to decipher the protein change if you don't have it. Let's just I honestly, this is actually a missense too, so I will call it a missense. Let's give it like 25% VAF. So let's just change this third mutation that I used. You can copy paste stuff into this, but again, ideally I would suggest that you copy and paste into the formula bar and not directly. But if it's a really small chunk of text like the mutations, it's okay to just direct paste, right? Like this one, let me just get rid of the nucleotide change, and you see what happens, and the whole cell turns red. I don't want entries like these where you don't have the nucleotide change. So please do try to include the nucleotide change at the least so we can decipher the protein changes. And of course, yes. So in this case, it's actually a missense, so I will leave it at that. But I don't want reds if you're able to go back and hunt for your data, right? And this is a missense. Let's give it maybe, I don't know, 7% VAF. And again, VAF can be only between 1 and 100. So make sure we have that validation going on there. With that said, structural alterations, this is any losses or deletions basically, and rearrangements that you can detect by NGS, right? This is all NGS again, right? If you have a copy number alteration algorithm in your pipeline, then use that just for the P53 based structural alterations that your pipeline can detect, right? And the next is for all structural alterations that are in co-mutations, not co-mutations, but other genes, but TP53. So here there's a homozygous deletion of CUX1 and there is a RUNX1 amplification, right? So I typically will use HOMDEL, DEL, AMP, REAR. I use small codes like these. So stick to these kinds of codes that you see in the examples, and make sure you put a comma between each alteration. So you can put a dash for the gene dash alteration, comma, gene dash alteration. Yeah, try to follow this format as much as you can, and certainly don't forget the commas if anything. Yeah, all the others I can still fix. And the next is all co-mutations. Again, if you have a bunch of co-mutations, I want you to paste in the formula bar and not direct paste over here, because if you direct paste here, then it's going to be an issue. I can show you, for example, if I direct paste, copy this, I don't know if this will, the font size will kind of shrink automatically to fit the cell, but be careful before you paste a whole bunch of mutations. Make sure you do not paste VUSs. Certainly only pathogenic and likely pathogenic co-mutations I want up here with the VAF and the changes. You can pretty much copy paste. I'm fine with that, right? But make sure you use the formula bar based pasting, and then at least separate the gene that has the highest co-mutation VAF. Here TET2 has the highest VAF in this chunk of things. So I just said TET2 41%. After that, I have two columns with the copy number alteration losses and gains. And if you have an algorithm, put something in. Here there is gain losses of 9q and 12p, and here there's gains on 17p and 7q. And if the whole chromosome is lost by the algorithm, then you can say 17p, 17q, right? And the next column is the entire list of genes being interrogated for that sample and the panel you're using for that, right? This may be the same across, I don't know, a few years, but we keep adding genes down the years into the panel. So I want to make sure that for that specific sample, the gene that we are interrogating is matching up, right? So if you're not interrogating U2AF1 in this panel, so obviously I'll have to make sure that I mark U2AF1 as missing in the commutation list if it's not being interrogated, right? So I need to have the data. So this is eminently a copy paste. So I would only suggest that you copy it from your report, the list of genes, and typically I want you to just paste it into a notepad first, and each gene should be separated by a comma. Whether you have a space or not, I don't care. But if there's a space, that's good. And then try to use this kind of a format. So I'm going to copy this and move this text file away, and I come into our area where I want to paste it. Go to the formula bar up there, right? Paste it, enter, right? And the whole thing pretty much goes in there. This is what I want you to do, Oh, sorry. Give me a minute here. Let me just show this again to you. So here is the what we want to. Let me get rid of this. Let me do the paste again because I don't think this was sitting in the field properly. Um, okay, here's the panel gene list back in focus. So I'll copy the whole gene list that I showed you, and I come to the cell, go up to the formula bar, Control V as in Victor, yeah, and enter. Right, that's the best way to paste things right into that field. And if it so happens that the genetic information you have is on an outside panel that but you're choosing to include the case regardless, and if you don't have in-house testing, then I want you to mention this is maybe neogenomics, right, neotype panel. And this was the panel that they had on the neotype panel back in, I don't know, 2018, right, when they maybe had fewer genes. And maybe the same panel down the line will have way more genes, right? So the panels keep evolving with the time, and I will account for missing genes in the panels based on the samples. So this is how you finish your NGS sheet. And typically we have only one row of NGS per patient. We are not doing serial NGS. It's only the diagnostic NGS, right? And then you hit the Control S or I don't know what did I do. No, no, no. Sorry for I think I closed the file by mistake, but that's fine. So